Hello, YouTube. This is Dennis Pabas with OPDC. Recently, PsychU hosted a webinar titled Call to Action, the Need for Stigma Awareness in Healthcare Professional Education. During the discussion, our speakers discussed the current landscape of mental health in America and how it is addressed within healthcare professional or HCP education, recognized the opportunities to address mental health stigma and self-stigma within HCP education programs, and they shared resources available to reduce mental health stigma within HCP education. As always, the presentation was sponsored by Otsuka Pharmaceutical Development and Commercialization and Lundbeck LLC, committed supporters of the mental health treatment community. Speakers are paid consultants to OPDC, and I am an employee of OPDC. Let's look at a few clips from the webinar. A 2009 American Psychological Association survey found that 87% of psychology graduate students reported experiencing anxiety and 68% reported symptoms of depression. So I'd like to start off the discussion by asking each panelist, how has the priority of discussing or teaching the topic of stigma changed in your curricula? And I'd like to start with Dr. Janos.
Thank you for the invitation to speak here. I would say for our training, what's really happened is that we've become much more proactive about anticipating distress and mental disorder among students and recommending services rather than waiting for problems to arise. I think that we've become more aware of this being part of the human experience in our field and something that needs to be proactively responded to.
Yeah, and also thank you very much for having us, Dennis. I agree with Dr. Janos. I can't imagine any training program in the country that hasn't intensified their efforts on trying to do a better job about teaching stigma. And like he also said, being very intentional about it, because we can't wait and let it knock on our door. We've got to root it out and find it at the very beginning of our students' trainings.
Thank you, Dr. Pabas, for inviting me to this very important webinar. This has become a real crisis. Every student, every pharmacy student will be a mental health first aider, and we're planning on rolling it out to the whole university.
So in closing, I really appreciated the discussion. I think it's a really good discussion. Hopefully you've given the viewers of this webinar some ideas that they can implement at their institution or their clinic, increasing their awareness of this issue. But I wanted to ask all the panelists, so what is your vision for the viewers? Really, why did you want to be part of this panel discussion? And I'll start with Dr. Janos.
I'm interested in this from multiple sides. So, mental illness is part of the human experience, right? It's part of what makes us human. And therefore, we should anticipate that our mental health and other health professionals are likely to experience mental illness in to some extent. At the same time, they're given a lot of responsibility, and that responsibility can be stressful and can even exacerbate some of the mental disorder that they already have. So we want to consider the wellness of our students, of our trainees. We also want to consider the impact that they have on the people that they're serving. And it's all very important. And it is a lot of responsibility for us as training directors and faculty and supervisors, et cetera. So one thing I can say is that stigma makes all of it worse, right? Stigma leads individuals to be less likely to seek help, to be more likely to sort of pass along that kind of discredit to other people. So if we create a non-stigmatizing environment and an atmosphere of openness, and that starts with faculty, supervisors, us being open and us being able to disclose without fear of consequence, then we we can set a chain of kind of openness along that will hopefully move along to the trainees and to the people that they're working with. So there's a lot that we have to do. A lot has to also happen on the legal side, right? As Dr. Chepke was noting, laws have to be changed, or licensing regulations have to be changed in a number of states, right? Because those consequences are real, and with regard to licensing, not so much for psychology, but certainly for psychiatry in a number of states. So those are things that we have to address as well. And we don't have control over that, but we can advocate within our organizations, speak up about those things as well. So there's a lot of things that I think are very important, and I see it all as being connected.
Thank you. Dr. Chepke?
Well, so the reason I wanted to be a part of this is quite simply because we've alluded to it a number of times already today, but stigma kills. A survey done by the Physicians Foundation in 2020 showed that almost 1 in 4 physicians knew another physician who had died by suicide. But it's much more personal that to me, beyond just that. Also in 2020, then my own uncle took his life by suicide, and after losing his lifelong battle with major depressive disorder, and really he died from stigma. He was doing great for the first time in probably decades, and he asked for my advice of, do you think I should get off this antidepressant? I don't think I need it anymore. And I had to talk with him that I do with all my patients, but ended with, as I do with patients, I know by the point someone asked me this, they've already made their decision, but and I'll support you either way. And for him, it was just that he didn't feel like he needed it, that it wasn't a medical illness that needed a chronic illness that needed ongoing care, like diabetes, which he had, hypertension, which he had, sleep apnea, which he had. And he was perfectly happy to continue all those treatments indefinitely. But the antidepressant, he was not, even though it worked great, had no side effects, no affordability problems, nothing. And so I want to, my vision would be that all of us within the medical profession, outside of the medical profession, all of society can remove those blinders that stigma puts on us, that makes us think all of these distorted thoughts about others and ourselves in far too many cases, and really see clearly that these are brain disorders, that we don't bear the shame and the guilt, that we do what we can, but there are aspects that are just as medical as any other illness in medicine. And I hope that some of these discussions we had today can help to propel that notion in training programs and across the country.
Thank you. Dr. Mandos?
Well, Dr. Pabis, I would echo what Dr. Yanos and Dr. Chepke said. It's, and I can speak from a personal experience. My college roommate died by suicide last week. So you're not alone. And, wearing my institutional hat, it's like, you're not alone. I've got a protocol, but you need to tell me you need some help. Then I can help you. So I think it's, having people understand it's an illness and not a weakness, I guess, or character flaw is the words I'm looking for.
Mm-hmm. Thank you for watching our YouTube teaser. If you'd like to watch the entire presentation on psychu.org, please click the link in the description to head to our website. You can also take a look at our upcoming webinars there. Be sure to follow us on Twitter, LinkedIn, Facebook, and Instagram, and have a great day.